Hi, I'm Claire and I've got schizophrenia.
We are a research team based at the Institute of Psychiatry, and we are dedicated to improving the lives of people with severe mental illness.
I became ill when I was 17 and I was diagnosed as having schizophrenia. I spent a year in hospital. I've been sectioned twice. At the beginning I was very depressed. I had delusional thoughts, I had hallucinations, and I had something which they call high sensitivity, which is you're more sensitive to noises around you. And I couldn't sleep. I thought my parents were trying to kill me. My sister was poisoning my food. I had slight hallucinations and I could hear voices.
One of the aims that we have is to ensure that people are treated appropriately. We find out what the effects of the drugs are, and then ensure that people who are treated with the newer drugs that are available today have good functional outcome. By that I mean a good quality of life, being able to go back to, say, a part-time job, being able to go back to their education. Our research focuses on developing strategies to identify these severe mental illnesses very early. So we have emphasized the fact that the intervention in schizophrenia perhaps needs to be before psychosis erupts. One of the ways in which the section of cognitive psychopharmacology has advanced research in schizophrenia is to place the emphasis back on cognition or brain function. Patients with schizophrenia are not able to think clearly. They can't attend to day-to-day activities. They have a problem with their memory. In emphasizing this problem in schizophrenia, we have also shifted the target of treatment away from the usual suspects of delusions and hallucinations, let's say beliefs that might be untrue and hearing voices, away to the most important part of the disease itself, the core and enduring feature of the illness, which is cognitive dysfunction. Schizophrenia is probably one of the most stigmatized illnesses.
The worst thing about having schizophrenia is other people's perception of you. People tend to be very scared, they don't know how to approach you. But the thing about schizophrenia is normally the person who suffers from schizophrenia, like myself, they're more scared of other people. If I meet somebody who doesn't understand schizophrenia, they're very wary of me and they make me realise that I've got an illness. When I became ill, my family and friends were very frightened, scared, worried about me. But now they're not frightened of me anymore. They understand schizophrenia. They understand I need to take medication and they're very supportive. I have been involved in a lot of research at the Institute of Psychiatry. I've had brain scans, eye movement tests, IQ tests and psychoneurological tests. These tests were to help research into mental illness and schizophrenia.
We use brain imaging as a technique that allows us to look at the structure and the function of the brain. It is amazing to be able to look at almost real-time images of brain function. We have shown that there are decreases in gray matter. The size of the brain is smaller in schizophrenia, and by showing that there are structural and functional abnormalities in the brain, we place illnesses like schizophrenia within the biological context. This gives hope to people. It tells them that schizophrenia is no different from diabetes, from heart disease, from rheumatoid arthritis, that most medical illnesses do not have a cure, but can be controlled and can be controlled effectively. Functional MRI is a new technique that allows us to look at the brain in action. It's a safe and effective technique because it doesn't involve any radioactivity. So we can use this technique time after time to look at the progression of changes that might happen in somebody's brain. For instance, one might want to say, well, what is the effect of a drug that we are giving a patient suffering from schizophrenia? What does this drug do to the brain of a patient? And we have been able to show how brain function normalizes when patients with schizophrenia are taking newer medication. We now know that there are effective treatments for schizophrenia, and we know that people with schizophrenia have the ability, as you saw in Claire's case, to go back and live extremely productive lives.
In my spare time, I like to sew and make clothes, visit my friends, go shopping, go to the cinema. I try to live as normal life as possible. There are certain things you can't do with schizophrenia. I find I can't drink anymore. I can't have late nights. However, I'm living as normal life as I possibly can with schizophrenia.
Our work is not just in schizophrenia. We work in other disorders like depression, in Alzheimer's disease, and in manic depression or bipolar disorder. We use several tests to figure out what the problems are in brain function. These tests are also known as biological markers. These biological markers allow us to say what is wrong with the brain in schizophrenia, depression, manic depression or bipolar disease and Alzheimer's, and then allows us to look at the effects of treatments. The techniques that we have currently within our group are able to discern whether a drug can be developed and better treatments can be developed for patients suffering from various illnesses. We have the unique opportunity of watching the effects of the drugs we give our patients in almost real time. That way we hope to develop better treatments for people who suffer from severe mental illness.
I think it's crucial that research should take place in this area to help people like me, to help other people in the same situation, to help doctors and psychiatrists to understand more about the brain and schizophrenia. To improve my chances of getting a job, I need people to be aware of schizophrenia and not to be frightened of it.
The SCP need people like you to help people like me.